Wash your hands and observe standard precautions. Assess the need for medication, in this case, checking the blood sugar. Explain what you are doing and check the patient's ID.
Hi there, Elma. I need to take your blood sugar.
Okay.
Can you tell me your full name and date of birth?
Alma Jones, 2638.
Thank you, Elma. Elma, which finger would you like me to use?
Well, I think maybe the middle one, it's less sore.
All right, Elma. Okay, Elma, you're going to feel a small prick here.
Okay.
Your blood sugar is 154.
Oh.
I'll need to get you some insulin.
Confirm the insulin dose with the physician's orders and the MAR. Read the label 3 times. When it is taken from the medication cart, before withdrawing the medication, and after withdrawing the medication. Mix the solution by rolling the vial gently between your hands. When mixing insulin, always withdraw the regular insulin, which is clear, first to minimize the possibility of the regular insulin becoming contaminated with the additional protein in NPH, which is cloudy. Remember, clear before cloudy. Clean the tops of the vials with the antiseptic swab in circular motion. I'll use the example of mixing 10 units of regular insulin and 30 units of NPH. With the vial placed on a firm surface, insert the needle into the center of the rubber cap, maintaining sterility. Inject 30 units of air into the NPH vial and withdraw the needle. There should be no insulin in the needle, and the needle should not touch the insulin. Inject 10 units of air into the regular insulin vial and promptly withdraw 10 units of regular insulin. Reinsert the needle into the NPH vial and withdraw 30 units of NPH. Be careful to withdraw only the ordered amount. If excess medication has been withdrawn, discard the syringe and begin again with both insulins. Withdraw the needle and replace the cap over the needle using the scoop method to maintain sterility.
Hi there, Elma.
Recheck the
I have
patient's
your
ID and
insulin
create
here.
privacy.
I'd like you to please tell me your full name and date of birth.
Alma Jones, 2638.
Thank you. I'm just going to lower this side rail here.
Okay.
Great.
Wash your hands.
And I'm going to wash up my hands, and I'm going to need to have access to your arm here, so I'd like you to raise your arm up.
Okay. Is this the way you want me?
That's great, Elma. Thank you so much.
Yeah.
Compare the MAR to the medication to be given. Wipe the injection site with alcohol swab and let the skin dry.
Great. We'll let that alcohol dry, and I'll give you your injection in just a moment.
Okay.
Okay, Elma, I'd like you to take a nice deep breath for me.
Pinch the skin and insert
1,
the needle
2,
into the
3.
skin at an 80 to 90 degree angle and inject.
That's good. The needle's coming out now.
Discard the
Okay,
needle and
Mama,
syringe
we're all
into the
done
sharps
there.
container. As always, document that you gave the
First, you
medication.
want to select an appropriate injection site. The sites include the fat pads on the abdomen, fat pads on the upper back, the lateral upper arms, the thighs, and here are the preferred injection sites for insulin, which are the arms, abdomen, thighs, and buttocks. And you should always rotate those. And the preferred injection site for heparin is a lower abdominal fat pad just below the umbilicus. The supplies you will need is the patient's medical chart. Obviously, if it's electronic, you can just check things like the allergies and just verify the order. You'll also need the prescribed medication. You'll need a 25 to 27 gauge needle that can be 1.3 to 5/8 inch of length. It's basically one of the smallest needles you can find. It's the one that you will see in either an insulin syringe or tuberculin syringe. You will also need a 1 to 3 ml syringe, antiseptic pads, whether your facility uses alcohol swabs or chlorhexidine, either one is fine, whichever one your facility recommends. You will also need gauze, gloves, and if you're going to be using a glass vial, you will need a filter needle.